Welcome to the knowledge series for Yogakshema. I am joined by Dr. Usha, the founder of Yogakshema Rehabilitation and Wellness Center. Today's session we will be covering mindful parenting. I'll come to another area, symptom, which is again I think generates a lot of anxiety amongst parents of teenagers and even younger kids these days, is the issue about mental health. Now, I think the issue of mental health, especially among youngsters, is an issue of our day and age. I'm not too sure whether it was such a serious issue way back, but currently of course, media is far more, talks a lot more about it, and hence it is more well known. But this is a top problem, at least when you talk to parents, they worry about. It's not that there is a symptom or there's something that they're worried, but you suddenly hear that such and such a child of a very good background committed suicide because that child had depression. Right now, this spooks parents because nobody knows how do I identify this, what exactly is happening, what is the mental health issue that our children are going through, and how do I kind of ensure that I am on top of the game on this. As parents, there is a mental health crisis that is around us in the younger population, and as a parent, how do I ensure that I am fortifying my household and fortifying my child to take the right steps? What are your thoughts on this?
This is again such an serious and crucial question, and it's also very close to my heart too, because and also through Yogakshema we are putting so much effort to work towards this, of course not just with kids, with anybody, to remove that social stigma that is attached to the mental health issues. We have conducted many workshops on depression, and not just workshops, and recently just completed 1 whole years of treatment for depression in a non-pharmacological way without giving any medicine. We have treated people with depression, and we have included their caregivers, and we followed them up for 1 whole year, and just last week we completed 1 whole year of that study. Why I'm saying this we have been working for many years, and we also have a way of treating anxiety also without medicine, and all of this as knowledge as medicine series of workshops and treatment.
And hopefully we'll handle it as a separate problem in future. I think one of the series will be on depression, I'm sure.
Yeah, hopefully, yeah. So this is a really grave situation, because what the statistics say, WHO statistics, not only the percentage of people with depression is increasing, the age of people with depression is decreasing so much, so it is now come down to like a teenager, 13 or 14 years, kids, which was never ever heard of earlier.
I've heard 2 kids, people known to me, commit suicide. I mean, it's nobody understands why. Right?
It has happened in my own family, so it is even close to my heart. I've taken it up as a way to how can we make this as a way to bring, not only just bring awareness to the other family members, and it is not anybody's fault. We cannot blame anybody, neither the parents, nor the children, nor the society. It is everybody's issue. If we take it as an issue and we can work towards it, if we take it as a problem, then it becomes somebody's, and even societal problem will be looked at in a different way. This is where the positive psychology approach is much better than, in other words, looking this as an issue, societal issue, rather than as a societal challenge. How do we deal with that, right? Again, the approach that we take in Yogakshema in treating depression itself, let us take depression. There is both an inside-out approach and an outside-in approach. Yes, we need to understand why this happens, everything, the why in terms of science, the chemical imbalance, how we can correct all of that. That's the inside out approach. But equally important, even more important, especially with respect to the kids, is the outside in approach. This the parents have to be convinced. So that what does that mean, outside in approach? By changing our behavior, by changing our habits, we will be able to change the imbalance that is created in the brain. In other words, there is a very close connection with mind and body. We understand this mind-body connection. Along with the connection between mind and body, even our behavior is also very much connected. So this mind, body and behavior connection, if we can understand this, so change the behavior to such an extent that the mind itself changes. Rather than understanding mind and changing our mind, changing our actions and then changing our lifestyle, this is where the role of parents come in, Samit. And importance of nutrition, importance of physical activity and importance of sleep. Extremely important. These three things, if it is taken care of, which is the outside in approach, nutrition, I'm not asking kids not to eat junk food. That will never happen. We need to give ourselves permission to eat certain things, to do certain things in a restricted manner. So even that we need to enjoy, not with guilt. So with parents can take the kids out for whatever junk food that they want to eat rather than making the junk food at home, so that everything has to be in moderation. If we go to extremes, that is where we're going to get into problems. Understanding all of this, we can do this, but only for that extent, so it won't affect our health, our life, whatever it is. So nutrition is very, very important, because we are seeing, we don't even can label this as depression, but young kids don't have zest for life. They don't even want to go out and play. This is all different ways of understanding depression. Right now we are seeing this. From Yogakshema, the treatment for depression, we did this in Baroda, right? And one of the psychiatrists was also involved in this program, and she happens to be a child psychiatrist. And after this whole program, and she was so convinced, and now the kind of kids that she gets, it's a lot of it is behavioral issues, and she doesn't believe in just prescribing medicine for either for anxiety or for sadness or for depression, and she wants to treat in an alternate way, with outside in approach, with the way the kid can understand, with the way more than the kid, the parents have to understand. But the beauty of this approach, outside in approach, it cannot be just for the kids. It has to be along with the parents of any age. And if you see it that way, it is such a win-win situation. The whole family gets better, you know. Maybe some issues, whatever it may be, habit issues with the social media, or depression issues because of that, whatever reason, but the whole family can get better, both physically and mentally. That is, that shift has to happen. So coming back, what type of behavioral patterns? Again, as we said, having nutritious food at home and physical activity. We need to make this as a way in our routine, family routine. Not only will it help in our health, physical exercise, but it certainly helps in focusing and concentration. This again has been established scientifically. Physical activity will improve the focusing power, will improve retention power, will improve the memory power, will improve the recall of events. So extremely important, physical activity. And sleep. Everything gets organized during the sleep. Sleep is one of the most important and most healthy habits. if for whatever reason the kid needs more sleep, not because the kid has slept at 2 o'clock, that you had to make sure, but understand that you need, and take away, that's okay, not by force, by choice. The kid has to put away the gadgets and let the kid sleep for more number of hours, it is fine. So the sleep pattern is again extremely important. Initially, whatever the kid needs, the kid can get so many number of hours of sleep, and then slowly the kid will know how to regulate that sleep and how to be energized.
Let me ask this question in a different way, Auntie. Is there something that our generation of parents are doing, or our society is currently doing, that is precipitating? I get your point on working on the habits, but is there something that we are doing which is wrong, or which we need to course correct?
I don't want to call it wrong, Samit, because even as parents we have done this without our knowledge, just like how the kids are doing some of the things without knowing the consequences. Because the younger generation that I see, the parents, just like even in our generation, we were the go-getters. You have to be successful, education is the ticket, and having the good career is the ticket for every problem, is how we were brought. And then we believed in it, and then we went after it. So much so, without our knowledge, we have neglected our own family members. And not just neglect ourselves too, absolutely. Not just neglect, we have even forgotten why we are doing all of this for. We are doing all of this for the sake of family, for our own loved ones. But neglecting ourselves, neglecting our health, neglecting our time, neglecting our spouses, neglecting our kids, we are doing this without our knowledge. Little bit of awareness towards ourselves, and also seeing who have crossed this path, who have overcome all of this, whether we learned it the hard way or learned it a better way, and to respect that mode, and to kind of follow either through books or through people. There are plenty of ways that we can learn from people. But again, one of the drawbacks of the parents of this generation is they are so good, they don't want to listen to anybody else. They want to experience everything and learn. But some of it they don't realize they should not be experiencing for themselves. That is what we call that as learning it the hard way, right? There is no need for that. There's plenty of negative experiences from many societies, many cultures that we can learn from and move towards something that is positive. This is what Yogakshema is striving towards.
So can you give some specific point?
See, usually at least one of the parents will get it, especially when both the parents are working, or even if just one person is working, it's usually the other partner or spouse will know what is happening. And they will start making changes. Whichever way, they will start exploring how to be more compassionate, kind, and how we can try and look at the world view from a different perspective rather than how they were brought up with. Everything again depends on our perception towards the world. If we can get this understanding, if we have to take one key point out of this, to be able to understand the interconnectedness of beings. In fact, it's, if I'm correct, it's Thich Nhat Hanh who calls this as interbeingness. If we can understand that we are all interconnected at a deeper level, today it might be my child, next day it is the next door neighbor's child, and somebody else, and not just one child. Many people going through similar problems and issues. If you just look at it, it's my own problem, my own family problem. I want to keep it within my family and not expose anybody to these issues and problems. That is not a healthy way to go about. Here, much more than just the parenting issues, this is an opportunity for parents to evolve themselves. In other words, truly ask the meaning and purpose of life, and if they need to take course correction, then that is what needs to be done. Many a times we're only going after success. We're only going after nothing wrong, by the way, name, fame and wealth, which is what mainstream calls it as success. We need to make a shift, first starting from parents and then inculcating this with the kids, that we need to aim for excellence. Not success, because excellence comes from within. Success is measured from outside, and success comes from an external point of view. So the mirror has to be our competition. Yes, we say this, but are we doing this as parents? This is the course correction, and not even course correction, a shift, a paradigm shift has to happen, that we need to aim for excellence and not success. Happiness just ensues. You have seen this, Sumit. People who are successful not necessarily are happy, but those who aim for excellence are definitely happier. The end result, or the happiness ensues, because they are doing this for themselves.
So in a way, if I were to kind of step back and rephrase what you said, of course there are multiple behavioral workings that we need to do, but also there is a pursuit of success as a habit that has been inculcated, or we took it up when we were very young, is also creating an atmosphere which is dysfunctional for our children, given the circumstances in which they are present. Is that the right way to read it? And instead of looking at pursuit of success, can we step back and inculcate in them pursuit of excellence? Absolutely. Right, which is probably more neutral to the outcome. Are you speaking this from the context that there is a lot more pressure on the kids to succeed because they see their parents? Is that what you're?
Absolutely, that's one of the main reasons. Not only without their knowledge, some of the parents, not all, they are putting pressure on the kids. We have done this. You have to get to such and such a college or an institution and get to somewhere to be that and whatnot. Not only that, the kids themselves are putting a lot of pressure on themselves, because they also know the things that they are not doing right, and that guilt factor also comes in. So it is a whole lot more the kid is going through these days. As parents, we need to understand. We have to tell them that we understand this is what it means by treating a teenager as a friend, not by doing things, by being like a peer and understanding what the kid is going through, not just with our actions, If the kid knows whatever it is doing is not kosher, not to whatever its own standard, so there is a factor of guilt. And on top of it, if that has become a habit, moving towards addiction, the grades will be affected. Rather than parents taking this as a punitive measure when the grades are affected, that is the time to really understand what is going through and work with the child, and the child will also be ready to be understanding. Is the key here. That is how a parent can become a friend. Be like a friend to the teenager, not doing things like another teenager would do.